Hello class, this chapter is about pain. What is pain? We all kind of know what pain is if it hurts, but a good definition of pain is an unpleasant sensation that causes a feeling of discomfort. And this has to come from pain receptors. So it's unpleasant and it's caused by stimulation of pain receptors. And we have pain receptors all throughout our body. So, any unpleasant sensation that is caused by the stimulation of pain receptors. What does it mean to stimulate something? It means there is some type of change. And typically with us is if the change is going to cause some type of bodily harm, then it typically will stimulate pain receptors. And this allows us to have use pain as a body defense mechanism. For people who are unable to have pain receptors, and some people are born without having pain receptors, they do a lot more damage to their body. So pain really just warns us there's a problem, or we might need to take it easy and stop stretching quite so far. A lot to do with pain is very complex. We know some of the basics, and we're going to learn a lot about it, but how certain pains, especially chronic pains, exist, and the different levels of tolerance between one person and another, we don't quite understand all of it. And it's important to realize that a lot of times when we're talking about pain, we always use subjective scales. And this allows us to compare pain levels from time to time. So it doesn't really allow us to do pain from one person to the next, but it does allow us to do comparative pain for one person from 8 a.m. to 12 p.m. And if you've ever been to the hospital, one of the things, or you know somebody who's been to the hospital, one of the things they ask you is to rate your pain. And so they will, or have you look at, for little children, they will look at the little, and ask the child, which one are you? Are you a little smiley face? Or, are you crying out in pain? And screaming. So, and then you have in the middle where it's just a slight discomfort and you're unhappy. So, you can do subjective scales for over time. Okay? Causes of pain. There are several different underlying causes of pain that we pretty much understand some of the mechanisms behind. One of the first ones we know is inflammation. And for inflammation, it has four characteristics: redness, swelling, heat, and then lastly we have pain. And inflammation usually has some kind of cellular damage where there are chemicals released, and those chemicals will cause the pain receptors to be more susceptible to be stimulated. And they get stimulated maybe from the pressure or from the chemicals, and that's going to cause that area to be a little bit tender and in pain. Infection, which is different from inflammation. Inflammation is those four characteristics. Infection means there is some kind of microorganism or some kind of organism that is growing and living inside the body. So you might have a bacteria like streptococcus or a staph, or it might be a tapeworm, and both of those can cause pain in different areas. Ischemia, which is dealing with low blood oxygen. So if the tissue is dying and they're releasing little chemical signals out, and those chemical signals are going to just scream and cause those and wake up those pain receptors, which are going to send the signal back to the brain. And then also, here's a common one: if we've ever stepped on our ankle wrong and twisted our ankle or anything like that, when we stretch tissue and we stretch tendons and ligaments, we tend to find out that it can hurt. And why would we want this to hurt? What's the benefit of this? Why do we want to hurt ourselves and feel this hurt? It's to stop us from going any farther and halting that activity that's causing the pain. Then we can have chemicals that are made in the body, and chemicals that are not made in the body. So if you spilled acid on your arm, that acid would burn the skin and it would cause pain. Somewhere else that we might want to talk about pain, which is a lot more common, is spicy food. Spicy food. So that spicy food is going to deal with chemical receptors that are pain receptors that are stimulated, and that's the reason why your lips burn after you eat a red hot chili pepper. And then lastly, we have burns, which is caused by heat or sunlight. We have sunburns. They also damage those pain receptors, which are called nociceptors, and that's going to cause pain also. And lastly, the muscle, when we have muscle damage, muscle spasms, it stimulates the pain receptors. We have two major categories of pain, which we can categorize pain all different kinds of ways, but one of the ways we do it is somatic pain versus visceral pain. My lines are a little bit crooked, but it's okay. So we can still read somatic pain versus visceral pain. Somatic pain typically deals with our skin and our appendages. Okay, so if we have pain in the skin or in our bone or a muscle, it's called a somatic pain. And this pain typically occur. You feel the pain where it's happening at. Okay, but in visceral pain, which is in the organs, so just think about all those organs in the abdominal cavity and the thoracic cavity. When you have pain in those organs, sometimes the pain is a little more diffused, and we don't know exactly where it is, and the pain might be up in let's think about our heart. It's over there in the arm when it's actually the heart that's getting the damage. And those are conducted by different fibers. So somatic pain is typically sensory fibers, which are just simple sensory fibers. And then we have sympathetic fibers. And if you go back to sympathetic, you know that's one branch of the autonomic nervous system. Okay? And sensory fibers take information in from our skin and from our bone and muscle. And sympathetic fibers are part of the autonomic nervous system, and they take information to the brain also. And visceral pain we typically see as either acute or chronic. And if you remember, due to our vocabulary, acute means it's short, has a very rapid onset, it just happened, and it's an acute problem, it just happened. Chronic means this happens over a long period of time. So we can always have an acute problem, acute pain, and then it transforms into a chronic pain later on. So pain pathways. The pain has to travel from the area of the body to the brain, because all our pain is basically registered in the brain. So we have what's called nociceptors. And nociceptors is just a special name for pain receptors, and they typically are free sensory nerve endings. So they're a sensory nerve, and at the end of it, instead of having axon terminal or dendrite or something like that, it's just a little free nerve ending. It's and it usually typically goes into the different tissues. Okay, and some things that stimulate pain pathways are temperature. Okay, so extremes of temperature. So anywhere pretty much between above 40 degrees Celsius and below 10 degrees Celsius. And if you know the human body is about 37 degrees, anything above that's going to be painful. That's why something really cold feels almost like it's burning you, because it's not really technically burning you, it's just you feel the pain receptors due to temperature. So you really associate extreme temperatures, they both feel about the same because they both stimulate those pain receptors and we get the same response. Also, there are chemicals, a lot of chemicals that are produced in the body, and such as acids. We all know about when we work out, we build up lactic acid, and that lactic acid would be something that stimulated those pain receptors, those nociceptors. and we have other ones like bradykinin or histamine or prostaglandin. And these all just make it stimulate these nociceptors and make them more likely to send an action potential down that nerve, and it goes to the brain. And then also we can have physical means such as like pressure. And we see this pressure a lot when we talk about things stretching, and the pressure changes and we stretch too far and it causes it to be stimulated and lets us know that we're going too far and we need to slow down. And each neuron or each nerve ending all has a very specific level of stimulus that it can stimuli that it can take before it fires. And one of the things that for that signal to transmit to the brain is we have to reach threshold. Okay, and you should know from your other anatomy and physiology classes, threshold is that level that it has to reach before action potential can be transmitted down the neuron. And usually, to reach brain threshold, it doesn't really vary between individuals. So everybody has the same level of stimulation that will elicit a little bit of pain response. However, each person has a different pain tolerance. So the amount of level that reaches pain threshold is pretty much universal. But each individual person has a different pain tolerance. So that's how well they cope with pain. Some people, especially those who are chronically depressed, they are going to be a lot more sensitive to pain. And some people in different cultures are less expressive. So as far as you just need to know that it varies culture to culture. So just because you're not used to when you get stung by a bee, you cry and boo-hoo. Someone else, it still hurts them. They get stung by the bee, but they just might grimace. So everybody, it hurts each person, but their tolerance is a little bit different. Also dealing with pain pathways, one way we can sort of kind of figure out where there's damage in the spinal cord is through the use of dermatomes. And dermatomes are just areas of your skin that are innervated by a specific spinal nerve. So basically, if we have a little person, we have nerves coming off their backbone, and each little nerve has different different receptors. And so if we stimulate this part of their body, it sends it up and we can say, oh, they can feel it right here. So that means that spinal nerve is not damaged. But if we stimulate over here and they can't feel anything or there's no pain, we know there's something going on with this nerve. Okay, that's this spinal nerve. So and it's very universal throughout the entire body with our skin. Okay. Also, when we talk about pain pathways, we need to talk about reflexes. We've been over reflexes before in some of your other classes you should have. And a reflex is just an involuntary pathway where we have the pain receptor that sends a signal up to the spinal cord or to the brain, and then a signal goes back down to the muscle. And that muscle is going to either contract to try to move your hand. So say you touch a hot skillet, you're going to automatically, that muscle is going to contract and it's going to pull you away. Even before you feel the heat, you're going to begin pulling away. And also we have reflex response that actually guard against movement, which is where the muscle contracts and tightens up and we sort of kind of ball up and we can't really move because we're in pain. So that's another reflex response that deals with pain pathways. One of the major theories that we use to sort of kind of describe and understand pain is called the gate control theory. Okay, the gate control theory. And this system has a series of gates that are built into the normal pain pathway. So there's a pathway going from, say, your little pinky all the way up to your brain and back. And we can basically modify that pathway at certain places, at certain gates. And so we can either make it more painful and we feel it more, or we can bring it down a little bit, depending on how we stimulate those gates. and transmit. So when the gates are open, we typically say the pain impulses are going from the periphery to the brain, and when they're closed, we typically reduce or modify the passage of pain. So we can see the gates are open, so the signal is going from the painful stimulus down the nociceptor, and it's going all the way to the brain where we were actually perceiving it. Okay? And if they're closed, what we do is we typically block the signal from the nociceptor going up to the brain. How can we block it? We can release opiates. That's one way. So such as, Tylenol, ibuprofen, aspirin, those types of things, morphine, they can block the signaling. That blocks the signal and therefore it doesn't go up to the brain. Other ways you can do it is through things like cold packs. They can release absorption, the application of ice. Impulses from the temperature receptors close the gates. They sort of kind of block out. So you feel the ice more than you feel the pain. Transcutaneous electrical nerve stimulation. This is where they kind of put a little thing that kind of shocks that area, and it actually will block the pain transmission. And then you can have other chemicals, opioids, and some of them are actually made by the CNS, and which is the central nervous system, and they're endogenous, and they actually come from the own central nervous system, and they can block it. Most of them resemble like morphine, which are artificial, which were actually synthesized drugs that we put in, and they will break it. They will block some of the pain. And they're encephalins, dynorphins, and beta-lipoproteins. They all can be used to block pain naturally. Another kind of pain that we talk about is referred pain. This is sort of kind of like the heart attack we talked about earlier. So it makes the source may be very difficult to determine. And this usually occurs with visceral organs. The pain may be perceived at a site that is very distant to the source. That's what referred pain is. The pain is not at the site of the source. And we usually see it, like I said, with visceral damage in the abdominal organs and the thoracic organs. Sometimes, like in a heart attack or ischemia of the heart, we have damage to the heart, and then we end up feeling it all the way in our left arm and our left shoulder and our neck. The pain just kind of refers out. It's hard to pinpoint where it's at. And you can see a lot of the different locations of referred pain. And you can see cardiac ischemias in the neck, the jaw, and under the arm. Okay. You see the things like cholecystis, which is dealing with the gallbladder. It's sort of kind of in this upper right quadrant. And then biliary, the appendicitis is here, even though the appendix is a little bit lower. Colon pain is sort of kind of right under the navel, and then small intestine pain, sometimes we find it is right above the navel. And so it just is kind of referred out. And the kidneys can end up being in your back, and the renal colic is there. So referred pain just means we're not where the actual damage occurring is. Another type of pain is called phantom pain. So it's sort of kind of like that phantom limb syndrome. It's like you lose a limb and then you feel pain in it. So it usually is in adults, and it becomes more common if that person has had chronic pain in the past. So you really can't find out what's causing the pain, but it can be accompanied after amputation, where you lose a hand and then you feel the hand kind of tighten up and it's not even there, and there's pain, itching, tingling. It usually doesn't respond to medicines and other common pain therapies. One thing they have tried to do is like actually put a mirror, and if the left hand is the one that's amputated, they'll put a mirror up to the right hand, and then you look at the mirror and you try to you release and open up both hands, and they say it seems to work, but there's a lot of it is not really understood. Acute pain, like I said, it's acute, so that means it's sudden and severe. It's usually short term. and typically it indicates some kind of tissue damage. If the tissue damage is local, the pain is usually going to be in a local region. So if it's in the abdominal region, it's going to kind of stay there. Sometimes we have acute pain throughout the whole body. Think about when you have the flu. Okay, you have the flu, you sort of kind of got a generalized pain everywhere. Typically initiates some kind of physiological stress response. So when we're in pain, we're in stress. Makes a lot of sense, right? And when we're in stress and we have this acute pain, we typically see some of the clinical signs are increased blood pressure and heart rate. We're going to have high blood pressure and a high heart rate. Typically the skin is cool, and then we're going to have a little bit of, it's usually pale and moist skin. Cool, pale, moist. You're sweating a little bit. You're in pain. Your respiratory rate is increased. You're breathing hard. And then you see a lot of tension in the skeletal muscle. Sometimes when pain is severe, we also see that vomiting occurs. And often it's paired with a strong emotional response. Chronic pain is kind of the opposite of acute pain. It occurs over an extended period of time. So we're thinking 6 months to a year. It may be recurrent. So it might only happen when it rains. So we see a chronic pain. It's usually a lot more difficult to treat because it's not dealing with a specific, it might be dealing with a very specific damage, but it's usually the damage isn't being healed. It's often perceived to be more generalized. So instead of being in a very pinpoint location, it's going to be in the whole general region. And often it leads, and may be paired with and leads to fatigue, irritability, and depression. Chronic pain usually goes hand in hand with those that are depressed. It can lead to sleep disturbances because if you're constantly in pain, it's going to be a lot hard to sleep. Specific causes may be less apparent. It's really hard to find the underlying root of the cause. And some people gain weight and some people lose weight because they're in chronic pain, and like I said, it's very difficult to treat. And continuing with this, it usually affects daily activities. So people, those with chronic pain in their back or in their knees or legs, they typically have to modify some of their activities. They can't stand for long periods of time. They have to have extra support. It may cause things like going to the grocery store to become really big ordeals. And there can be flare-ups where there is acute pain on top of the chronic pain. And so, and this expedites the acute pain. So those that have chronic pain typically usually have a lower pain tolerance. So something that normally a normal bump or scrape will hurt a lot more if they're already in chronic pain. Some of the ways that we manage pain medically is through analgesics. These are medicines that work on reducing pain, and we can take them orally, parenterally, which is just by injection, transdermal patches, and the way we organize these analgesics is by their ability to relieve pain. So we have mild pain relievers, moderate pain relievers, and severe pain relievers. Some of the mild pain relievers are acetylsalicylic acid, which is basically aspirin. And we have acetaminophen, Tylenol, and then NSAIDs such as ibuprofen. And this aspirin and ibuprofen are both anti-inflammatories, which is also going to reduce inflammation. And some of those adverse effects is the reason why you don't want to take too much aspirin or too much NSAIDs, is that it can actually lead to problems with the GI tract, such as ulcers and bleeding and allergies. For moderate pain, we typically see more towards things that have codeine in them. So we're going to have like Tylenol with codeine, or oxycodone, or Percocet, or Vicodin. And so we see the codeine with the Tylenol or aspirin. And these are typically narcotics, and they can, have high doses, depress respiration and can be more addicting. And then for severe pain, we see things like morphine and Demerol, and methadone, meropenem, oxycodone in different amounts. And these also act on the central nervous system, and they can also lead to addiction, and they depress respiration, nausea, and constipation. So they have a pretty kind of big effect on the GI tract too, but in a different way. And one of the things we worry about when somebody already has low respiratory ability, we have to be really careful with giving them severe painkillers. So here's the end of our slideshow. Go ahead and watch this, and hopefully you'll be prepared for your test.